Okay, when you hear the word ADHD, you probably think of children. But did you know that adults can also suffer from attention deficit hyperactive disorder? Do I know it? I live it. Welcome, Dr. Sara Stein from Kaiser Permanente. How are you?
Thank you, dear. Good.
Duh. That's all I have to say is duh. Well, I think that's me.
I think it's a lot of us.
Really?
Mm-hmm. So when we talk about attention deficit disorder in adults, there's really two groups. There's a group of adults who were never diagnosed as children, and typically those are people who really never had hyperactivity, so they didn't stand out behaviorally in the classroom.
Yes, because that's what the H
stands
for.
They had good impulse control, so they never wound up getting in a lot of trouble at home so that they got taken to the doctors.
Yes.
Or they did, and this is we see this with overachievers, they did what we call hyperfocus, which is that they would procrastinate and not do their work until the very last minute, cram for exams, and when they did that, they raised their brain chemistry of, it's called norepinephrine, and it makes you focus. And so for that day, they were able to cram all that information in, ace the test, and do great.
And that is me too. That is ADD.
Absolutely.
Or ADHD?
Right. That's called inattentive attention deficit disorder.
Now, is that something you're born with, or do you develop it?
Well, interestingly, you can develop it, and one of the causes of attention deficit disorder is processed food. When they did a study of 1,600 children, the children who ate Western diet processed foods were more likely to have attention deficit disorder than the children who didn't.
Really?
So there's a lot of causes in children besides genetics that would lead to this.
Okay, so can the same thing be said for adults? Like if we're eating processed foods, would it bring out the... I can't even remember what I was asking.
There you go. I think you can probably say that. So what happens is this group of people, they get to adulthood, and suddenly two things happen. One is there are too many tasks, and so they get completely overwhelmed, disorganized.
This is so freeing for me. Is anybody else relating to this at all?
Yeah.
Yes.
Absolutely. Absolutely. And the three causes, there you go. Look at that.
Okay, the three
causes of memory problems that in middle age that are most commonly identified are multitasking, stress, and depression.
Okay.
None of which are attention deficit disorder, but all of which will cause symptoms that mimic attention deficit disorder. Now, there's other things that will mimic it.
Okay.
Medication effects, and I need to tell you this because this is really important. Allergy and over-the-counter sleep medications will mimic attention deficit disorder. It will impair a chemical in your brain called acetylcholine, which is your memory chemical. And so when they followed people who took allergy pills, 10 years later they were more likely to develop dementia.
Really?
And over-the-counter
I guess it's a good thing my insurance company doesn't cover the allergy medication I need.
Well, it could be over-the-counter, too.
I don't take over-the-counter stuff.
There you go. Good. And sleeping pills, too. So, you know, I sneeze like the rest of us here. Yeah. So I tell people just minimize it and use it only when absolutely necessary, and don't get into a habit of every day. So the other reasons why we have multitasking and stress and the smell of really good food, obesity is another independent risk factor for memory problems in adulthood. So there are a lot of things that you can do to just improve your health a little bit. Watch what you eat. Exercise is one of the best antidotes. Getting a good night's sleep, trying to relax a little bit. Help yourself be organized with notes and tasks. And
what if you can't, though? Truly, I can't.
You can't?
I mean, people say, what are you going to say when we come out, or where are you going to be? I'm like, I don't know, because I wait until the last second.
A good assistant always helps.
That's what I was saying.
Have a great producer.
Okay. And any besides exercise and eating.
Well, there are medications that we use. There are medications. There's a class of antidepressants that will improve focus, and there are, of course, the stimulants. However, the stimulants in adults, you get into the side effects and risk factors of things like increased blood pressure. So, right. So we have to be really careful medicating. And so that's what we say to people is go to the doctor, get a workup, clean up your lifestyle as much as you're able to, and get some rest, and see if you still have the same problem when you're relaxed, healthy on vacation as you're having during the work week under stress. Because if you don't, it's probably not real attention deficit disorder.
All right. Okay. I think I have it, though. Thank you, Dr. Stein.
Thank you.
From Kaiser Permanente, always good to have you here. And there is